The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone, and thank you for joining us. I'm Chris Van Dusen, the Director of Media Relations with the Texas Department of State Health Services, and appreciate you being with us for this update on COVID-19 vaccination in Texas. We have two panelists today. Imelda Garcia is the DSHS Associate Commissioner for Laboratory and Infectious Disease Services, and she serves as the chair of the state's expert vaccine allocation panel, which makes recommendations about priority populations and gives guidance on how Texas allocates vaccine across the state. Ms. Garcia will have some opening remarks and then be happy to take your questions. Also with us today is Dr. Saroj Rai. She is a DSHS scientific advisor and a resident vaccinologist, and she's on hand to handle any scientific questions about the vaccine, the development of vaccine, and the approval process in the United States, and kind of what we're expecting to see over the coming months. If you'd like to ask a question, please enter it into the question box in the webinar interface. We can see your name automatically, but if you would also include in the question your outlet, that'll help us recognize you and where those questions are coming from. We'll endeavor to answer as many questions as we can in the time that we have, and try to get a cross section, across the state, large and small outlets, and try to make sure we have things covered as best we possibly can. Do want to let you know also that you're welcome to record this and use it for news gathering purposes. We will also be recording the presentation today and sending a link out to that. It usually takes an hour or two after the conclusion of the presentation for that to be ready to provide to you. So with that, I'd like to turn it over to Imelda Garcia, DSHS Associate Commissioner for Laboratory and Infectious Disease Services, and as I mentioned, the chair of the Texas Expert Vaccine Allocation Panel. Imelda.
Thank you, Chris, and good morning, everyone. I'm happy to be here with you today. And first, just talk about kind of what's happened so far as our vaccination efforts have begun in Texas. And with this afternoon's update, we will report more than 2 million doses administered have been administered across the state. So we have about 2,057,000. That equates about to 1.7 million people that have gotten at least one dose, and about 370,000 who have been fully vaccinated. And that is a remarkable accomplishment, and it means that nearly 1 out of every 13 Texans at least 16 years of age has had a vaccine. But more importantly, for those Texans 65 and older, that's more than 1 out of every 6 Texans over 65 have received a COVID-19 vaccine. And so that's a huge, huge win for us here in the state. It has taken providers in Texas 4.5 weeks to record the first 1 million doses, and exactly 2 weeks later, we hit our second million. This would not have been possible without the dedication of nearly 2,400 providers all across the state that have administered doses so far. We've had a great start, but I don't have to tell you that there's still a lot of need out there and not enough vaccine for everyone that wants it. Our vaccine supply is still limited and based on the amount that is provided to Texas by our federal partners. We appreciate everyone's patience as vaccine continues to arrive across the state, and we understand that it can be frustrating at times. But the good news is that every week we get additional shipments of vaccine, and we will see an increase in the number of doses coming to the state here next week. Our reoccurring allocation of first doses will go up from about 333,000 for this week to about 385,000 for next week. And what we've been told is that we should expect that level of vaccine to continue over the next few weeks. But ultimately, it's never certain until we actually get the allocation numbers from our federal partners. We will also see a one-time boost in the doses that we can push out next week as the federal government returns about 126,000 first doses that we were required to set aside for the federal long-term care program. And that's essentially because it was overestimated the number of doses that was needed for that program. And so we did work with our federal partners in order to get those back to the state so that we could allocate them out. Now, with these one-time allocations, we will be trying to equalize the amount of vaccine in areas that haven't received vaccine proportional to their population. And so I wanted to show you a couple of maps that illustrate that. So when we look at these two maps, on the left, you have the proportion or the difference between what we've allocated to counties and the total population. On the right, we have what has actually been administered in those counties, so residents that have received vaccines compared to the total population. Now, the yellow and gold colors are those counties closest to where they should be based on their population, where the difference between the vaccine allocated on the left or administered on the right is within 0.25 percentage point of what you would expect based on their just population. And that's where the majority of the counties are. Where we see the biggest variance is in the urban and suburban areas. And that's been expected at this point because our first 4 weeks really focused a distribution on our healthcare workers. And that meant getting much vaccine to those large healthcare facilities that tend to be within the urban centers. So on the left, you see the above average allocations going to urban counties and below average to the suburban counties. But when you look on the right, and this is where doses administered, that some of that evens out, and it's showing that some of the people in the suburban counties are getting vaccinated in the big cities. And so, specifically, if you look at Fort Bend and Brazoria, those counties just south of Houston are red and orange on the left. But when you look at doses allocated, when you see doses allocated, they're red and orange. But when you look at doses administered for their residents within those counties, they're slightly back on where they should be. And so what we're trying to do with this one-time supply of extra doses next week is to allocate them to some of the suburban counties to help get them back on par. And we plan on publishing those allocation rosters for next week tomorrow, so please stay tuned for that. But I wanted to touch on a few other things before we open it up to questions. And one of the biggest questions that we get here at DSHS is, how does the allocation process work? And I want to just take a couple of minutes to walk you through that. So every Monday, we meet with our expert vaccine allocation panel, and that's at 7:15 every morning, and we typically meet for about 3 hours. Our team works the weekend prior to put together options on the allocations for the expert panel to consider based on estimates of what we think the vaccine will be for the coming week. So we have to draft that up in advance of the expert panel. On Monday, we walk them through what those options are, how it would shake out, and talk about proportions and providers and things like that. When the expert panel weighs in on the strategy and the direction of, what providers to focus on what proportion to send to hubs, and some other special considerations that they want us to take into, we take that information and then further refine the draft. We actually don't get our real allocation numbers from CDC until Tuesdays, and it's typically Tuesday afternoons, late in the afternoons that we get them. And so, the next day, then we're having to work on making adjustments based on whether or not we got an increase or decrease, or whether or not the mix of vaccine may have shifted. And so once we do get what the real actual numbers are, then we have a smaller group of expert panel members that work to help refine and make adjustments to our draft allocations in order to ultimately submit a roster to Dr. Hellerstedt for his approval. So he typically approves them early Monday mornings, in which case then allows the team to enter those providers into our VAO system. So that's our vaccine allocation and ordering system. And this is so that the providers can see what they've been allocated, they can accept or reject or reduce their allocations, based on what their need is for the upcoming week. We typically try to give them at least 24 hours to do that, and then we have to turn around on Thursday because the federal ordering system opens up late Thursday evening for us to be able to start placing orders late Thursday and early Friday. Now, we have to hit those targets in order for the guaranteeing that the vaccine will arrive as early as physically possible the subsequent Monday or Tuesday. In some cases, with Moderna, we've been seeing them show up early on Fridays. But for the most part, a lot of them arrive on Mondays and Tuesdays. And then we start the week all over again. And so we're in this cycle every single week with the team and the expert panel. Now, when we look at how do we determine where to actually send vaccine and the amount, this is where, over time, depending on the strategies and the guidance from the expert panel, this has shifted from where we were targeting on the healthcare workers in 1A, obviously really did a big push to hospitals and other healthcare providers for their own staff and other, eligible folks within that population. And as we shifted to 1B, the mix of how we did that was a bit different. And so we use population estimates to help guide allocations to providers. Now, as you know, we have recently started with our hub strategy. And so wanted to talk a little bit about that because beginning in week 5, which was the week of the MLK Day, we initiated our hubs, and this was an effort to do big high throughput and trying to get a lot of people vaccinated every single week. Now, the goals of those hubs, we're now in our 3rd week, so we're really happy about the progress that they have been making, is a couple of things. So the 2 big benefits that we get from the hubs is that, one, for the people looking for vaccine, they have a few places that they know will definitively be getting it and have ways for those members in the eligible 1A or B populations to get access to it. And they don't have to go and look for, dozens of providers every single week in order to find vaccine. For the providers, having a dependable supply of vaccine each and every week is exceptionally helpful for them so that they can plan their efforts and know when they need to have either a single large event or multiple smaller ones. Some of them are doing, moving around and doing some mobile sites. Others are partnering with other providers in their community to help provide vaccine at specific at-risk population groups and locations. But ultimately, we're not 100% sure each and every week about what that vaccine allocation will be. And so with the guarantee of the hubs that they get at least that minimal amount helps them plan moving forward. Now, in looking forward, the past 3 weeks we have been, the past weeks 5, 6, and 7, we have added hubs. For week 8, because I don't know yet if that is going to be a sustainable increase in vaccine, we won't be adding any hubs. We're going to wait a week to see what the week 9 allocations look like. And that's really because while the federal partners have told us that this is going to be a reoccurring thing, we really need to see it in writing and when we actually get our numbers before we make additional commitments to our providers about reoccurring amounts. And so for this week, we won't be adding, for this coming week, we won't be adding any additional hubs. Now, in exchange for that steady supply of vaccine, the hubs have to agree to a variety of different things. And so, wanted to just take a little bit of time to walk through what those requirements are in knowing what to expect from our hubs. And so first, they need to strategically place vaccines within their sites to serve and maximize the vaccine efforts across the state. They are required to vaccinate 1A and 1B populations, and so we're specifically still focused on those groups of people. And they have to offer that vaccine to regardless of whether or not they are resident of their county. And, early on, we had very few hubs. A lot of counties still do not, and so we want to make sure that they are open to their neighbors and surrounding areas because we didn't have enough vaccine to have hubs in every single county. Now, the other piece is, and this is a really important one, they have to use every single dose within that week that they received it. And so they need to burn through it within those 5 to 7 days. Another requirement is that it's imperative that there be an equitable distribution throughout demographics and looking at the hardest hit zip codes And so we do talk to them about this. There is some flexibility in how they go about doing that. As far as reporting doses, you know, we tell them they have to use each and every dose the very week that they get it. But equally important is that they report that to the state. And so they are required to report not only to our immunization registry in Track 2, but they're also required to report to the Texas Division of Emergency Management's reporting portal as well. And so that's to make sure that we have the best information on how many doses they're going through each and every day. In order to ensure that they are following all the safety requirements, they have to, you know, obviously monitor for adverse events. They need to report adverse events to the VAERS system, and then they are required to promote and encourage the Be Safe application as well. But finally, I wanted to say a couple of things about distributing vaccine equitably, because we know that that's been talked about quite a bit. It is absolutely a priority for our expert vaccine allocation panel. It is absolutely a priority for us here at the Department of State Health Services. And for me personally, it is a priority. And so not only equitably distribution across the state, but also within the cities, counties, and particularly in areas that are typically underserved by the healthcare system. We work to try to target particular areas and providers. For example, you know, we have focused on federally qualified health centers over the past few weeks. And these are centers that serve patients regardless of their ability to pay. We are directing our hubs to make sure that they serve diverse and hard-hit populations. But we also know that our local partners play a really critical role in this. They know their communities best, and they know how to reach those diverse populations that they have. So we try to work really closely with our local partners and help direct providers, direct vaccine to those providers and areas to make sure that vaccine is available. So in closing, we have 2 million doses administered and 1 in 6 65 and older having received their first dose. We have made a really strong start here in Texas getting folks vaccinated and taking critical steps to ending the pandemic. But we still have a way to go, and we'll get there together. But for now, as we continue to see more than 15,000 confirmed cases and more than 300 deaths reported every day, we need everyone to continue to take precautions like wearing a mask anytime you're around someone you don't live with, maintaining physical distance with others, staying at home when you can, and washing your hands frequently. And the more that we all do these things, the more effective the vaccine will be in reducing the number of cases and helping us get the pandemic behind us. So with that, Chris, let's go ahead and open up for questions.
Sure thing, Melda. Thank you. First question comes from Valerie Gonzalez at the Monitor. She says, "Good morning. When will the vaccines begin to be distributed to the smaller private providers like pharmacies and doctors' offices?"
So we continue to provide vaccine to some pharmacies and some private providers' offices. But ultimately, you know, with the strategy of us going to the bigger hubs, the majority of the vaccine is going to those bigger providers. As supply increases, and you'll notice in week 8 allocations that we have started increasing vaccine going to pharmacies and other providers as well.
Moving on to a next question. Sorry, it's scrolling here. Eleanor Dearman with the Fort Worth Star-Telegram asks, "What kind of communication has the EVAP and DSHS had with the new Biden administration about their plan for vaccine distribution? What does the new administration what does the new administration, its plan mean for Texas?"
So we have begun having some introductory meetings with the White House and their new team out there. I think we've had some really productive calls, hearing about their interests. They definitely want to learn what we were doing here in Texas. They are supportive of the work that we're doing and want to partner with us in order to how best get vaccines in Texans across the state. So we're going to continue to have that strong communication and collaboration. I think that, as they finally get more details on their policies and rollout, they will share that with us, and then we'll be communicating that further forward.
Kiera McCarthy with the Victoria Advocate asks, will vaccine hubs be prioritized for future allocations of vaccine? And as a follow-up, what was the rationale behind switching from distribution to numerous sites throughout the state to focusing on the hubs?
Sure. So within the expert panel, we did talk about prioritizing hubs and trying to get some bigger throughput. And this was largely driven because, as we shifted to the 1B population, just the demand for vaccine, really, really increased. So we wanted to afford a way to be able to do big numbers at strategic locations all across the state. Within the expert panel, we are having conversations about how long do we stay with the strategy before we pivot back to a more broader distribution across the state. And ultimately, a lot of that really depends on the vaccine supply. And so as vaccine supply continues to increase, we will have those conversations about when do we pivot back.
Moving on to a next question from Brad Stryker with KVUE. Can you please explain the strategy behind where we decided to put vaccine hubs and sort of how those hubs were selected?
Sure. So, initially we had 28 hubs across the state, and we had done a survey to ask folks what interest they had, who could do 2,000 a day during a week for the urban centers and 200 to 400 a day for the rural centers. And so we used some of that initial information to be able to target some high throughput providers across the state. So we did that within that first week and chose those providers that could do some big numbers. In subsequent weeks, we continued to get an outpouring of requests and folks laying out their plans as to what they could do within their communities in order to create a hub within those. And so each week, we've had a kind of determined process to be able to look and prioritize and getting vaccines to additional hubs.
A question from Brett Jaspers at KERA in Dallas. He says, good morning. There are about 45% of vaccinations that don't have race or ethnicity data. Why, and what can be done to fix that? Thank you for that question. So the data just hasn't been submitted to our immunization registry. And so whether the providers are collecting it on the ground and just not entering it is unknown. But one of the things that we are doing to improve on the data quality, we're doing a couple of different things. So we're going to be moving to make the race and ethnicity field required in order for the vaccine to be coming through, as well as we're also going to be redoing the user module, what they see when they're doing data entry, to make it easier to facilitate completing that information. And so that is going to be one area that we monitor moving forward about the quality of the data that we have for race and ethnicity. Great. Just as a reminder, and people are doing it, so I don't know that a reminder is necessary, but if you'd like to ask a question, you can just enter that in the question box that you should be able to see. Please do include your outlet when you're asking the question. That doesn't automatically come up, but it looks like most people are, but just a reminder so we can make sure we recognize you appropriately. So the next question from Meredith Yeomans at KXAS in Dallas. Can you comment on when the state plans to announce who's in the next phase of the rollout and when moving to the next phase is expected to happen? So as an expert panel, we continue to have conversations about the 1C population and who will be in the next group to move forward. At this time, we haven't finalized that definition, but we will announce that once we have come to a final decision on that and communicate that broadly. As far as when we transition to the 1C population or the next group, that really is dependent on the vaccine supply and how quickly the vaccine increases and how quickly we can get through our 1B population. So that's yet to be seen. Is there a couple of questions that are kind of follow-ups to that from a couple of folks as sort of how how do we make that decision? How will we look at what's occurring in the state and decide, okay, when is it time to open up to whether it's 1C or 2 or whatever we call the next group?
So, for us here in Texas, we didn't wait until we did all of 1A before we transitioned to 1B. We were looking at vaccine uptake and hesitancy and seeing, how quickly vaccine was flying off the shelves. With 1B, we know that, we're going to be here for a while. But as an expert panel, what we have talked through and the team is developing are some metrics about what those trigger points would be. We do expect that there will be another blended transition where we would have 1B and 1C or phase 2, eligible next. But that's something that we're talking through. We will continue to monitor vaccine uptake all across the state and talking with our local partners to see if there's signals about, slowness in vaccine doses administered, or whether or not we need to kind of stay within that phase for a little while longer. So that's how we're thinking through it right now.
And one other sort of related question from Karen Harper at the Texas Tribune. Is there a consensus yet in EVAP about who's going to be in 1C, and what do you take into consideration when you're making those decisions?
So I can tell you we have some really robust conversations about our eligible populations, and we talked for several weeks on the 1B population before we finally came to a consensus in the 1B population. I expect that we'll be doing the same with the 1C. We have had quite a few conversations already, and what we're looking at is the data first and foremost. And so what are we seeing in Texas as far as vulnerabilities and outbreaks on the case data? We are also, looking to see how the federal guidelines have been, and so that we pivoted away from CDC earlier this year. But with the new presidential team coming in, we don't know if there will be some additional changes to the next eligible population that we may want to take into consideration for us here in Texas. So that's kind of some of the framework that we use when we're considering who will be next in the eligible population.
We have time, just pushing up against the 11:30 here, so we have time for just a couple more questions. Santiago Caicedo at KRGV down at the Valley asks, does the state require that a person prove they live in Texas to get the vaccine? Can someone from another state or country on vacation get a COVID vaccine in Texas?
So if we really want to focus on the people that are living and working here. And so this is where if you may live in New Mexico but come to work every day in Lubbock or Amarillo, we want you to be vaccinated. And so those are the requirements and the things that we're looking for broadly. We know that there have been very small numbers of people that have been vaccinated from other areas beyond that, and it's minimally small. And so I think that the lion's share of what we're doing is indeed vaccinating those that live and work in Texas that are within our communities.
Closing it out, a question from Nicole Cobbler at the Austin American-Statesman. Is there a concern that rural counties could be missed because of the hub system, and will the mobile pilot program solve these problems? And finally, does the state have enough vaccine supply to expand that mobile program?
So with the first question with regard to, rural versus urban hubs and things like that. So that's definitely always part of our conversation within the expert panel in talking about how do we ensure that our rural areas still have access to vaccine. We have continued to expand some of the hubs within rural areas to cover a variety of different rural counties as well. Now, the state's pilot right now, which will be rolling out here shortly, is an attempt to help be able to get some vaccines to areas that may not have gotten it sooner. So we're going to try this out, see how it goes. Every effort that we do to get more Texans vaccinated all across the state are essential partners to that. And so we'll continue to partner with the Texas Division of Emergency Management in their pilot and in their rollout, as well as continuing with our local partners to create more opportunities for vaccinations.
And one final question to end on from Wes Rappaport with KXAN and Nexstar Media. What's the sorry, that's not the one. Is DSHS satisfied with how many doses have been administered at this point? And I guess, Imelda, asking you, are you satisfied with how many doses have been administered?
No. I think we've done a great job so far. Let me be really clear. We've done an amazing job. but we know we can do better. And that is the reason why we continue to reiterate over and over and over again to all of our providers across the state. Use the vaccine as quickly as possible. We want everyone to run out every single week. We don't want a single dose left on the shelf. It will only work if it gets in people. And so we are not satisfied with where we are. We continue to push. We're not satisfied with the supply that we're getting. And so we continue to push from that regard. So we will continue to work to improve how quickly we get it out. We'll continue to fight for us getting more vaccine to Texas. And ultimately, I know our providers are wholeheartedly dedicated to doing their part in using the vaccine as quickly as possible.
Mela, thank you for being with us today. I know you have to step aside for another appointment. And thank everybody else for joining us as well. Thanks to Dr. Saroj Rai for being on hand. We didn't get into that nitty-gritty scientific stuff, but maybe we'll do that at a future briefing. This is something we hope to make more of a regular feature as we answer questions and about exactly what the vaccine rollout in Texas looks like. So again, thank you for being with us in this sort of initial attempt at that and navigating some new technology and helping things go fairly smoothly. I know there are many more questions. If most people know where to find us. If you have any follow-up questions, you can reach us at pressofficer@dshs.texas.gov. As I mentioned earlier, this presentation is being recorded, and we'll send out a link to that when it is available. Also, we'll send out the map that was presented earlier so that you can take a closer look at that as needed. Thanks for being with us today and appreciate your attention on this COVID-19 vaccine update in Texas. Have a great day.